So how can technology advancements in the healthcare sector help address the challenges these days faced by the hospitals in MENA region, such as maybe rising costs and also an aging population as well?
Well, thank you. This is very good questions. Definitely technology is increasing the cost of healthcare, but technology play today a big role in terms of improving the quality of healthcare delivery. So we know that there is a plenty of technologies coming through, and those technology will, for example, reduce the length of stay, improve the quality of the healthcare, but definitely the cost will rise on. But for sure, what we see is this an improvement and big improvements in terms of delivering the healthcare.
So financing the healthcare projects is often a complex task, as discussed. Could you share some of the creative solutions maybe discussed in the MENA region or going to be discussed in the forum, which can help overcome these financial challenges?
Sure, and this is very legitimate questions in terms of financing the healthcare services. And if we talk at broad, we're talking about at a bigger scale about the PPP model. At lower scale, which is I will be addressing and talking about at the MENA region projects, is the leasing of the medical equipment. I believe this is not that widely available in the markets, in the local markets, but this practice had been for a long time in the US markets or European markets. So today, shifting the cost from a capital cost to an operational cost is very essential in terms of unleashing the quality of technology that could be adopted at bigger scale.
Managing hospital operations as well efficiently is also crucial for providing quality healthcare. Were there any notable best practices or strategies shared or going to be shared during this forum across the hospitals in the MENA region?
Definitely, the improving the efficiency of the healthcare services is being at the part as very essential part. In fact, what we addressed during the discussions is more talking about telehealth, telemedicine, which we believe it's become a central part of delivering of the healthcare, especially when we talk about primary care. And this type of services had been adopted widely after COVID-19 and around the world, and UAE and the regions will be adopting that at bigger scale. In fact, during the sessions we were talking about the KPIs related to the delivering of the telehealth, telemedicine services.
Yeah. So when we speak about telehealth medicine or even in this field, how do you think the MENA region is going to adapt to these changes or advancements?
In fact, there is no chance not to adapt it. It's going to be adapted at far better scale than anywhere around the world, because we believe today it is going to become the standards of care. That adopting the telehealth, telemedicine, first it offers the convenience, it proves it's a good and better than to get the people into the hospitals where they can get infection and they get more problem and more costly services. So by all scales, the adoption is going to happen at the level of the patients, and at the bigger level, the adoption from the governments it's moving on very fast.
So the final one question, what were some of the key insights shared by the industry experts so far at the forum regarding the role of public-private relationships in advancing the healthcare sector as well as patient care?
We believe the PPP or public-private partnership is going to play a bigger role in the region, especially in the GCC country, and where the government is moving towards to be more as the regulator versus to be the operator, and bringing the private sectors to be involved in this kind of services is become a very essential part. We know now in Saudi Arabia there is more and more requests and in terms of adoptions of the PPP model, and this is going to be adopted at faster scale around the GCC country.
Thank you. Thanks for that.